that we know what Horner syndrome is, let's talk about some of the key nursing considerations that the NCLEX could test you on. The biggest thing to understand is that Horner syndrome itself is usually a sign of an underlying problem. It's not the main diagnosis. So the NCLEX is going to care more about what caused it and what your priorities are as the nurse. So if a patient, suddenly develops the ptosis, unequal pupils, facial changes, neck pain, or neuro symptoms, your priority is recognizing that this could point to something serious like a carotid artery dissection, stroke, spinal cord injury, trauma, or even a tumor that is compressing the sympathetic nerves. So your nursing priorities are going to focus heavily on those neuro assessments. You want to monitor their level of consciousness, their pupil changes, worsening neurological deficits, vital signs, and any signs the patient's condition is deteriorating. Also test on safety depending on the underlying cause. The patients can have visual disturbances, dizziness, weakness, or impaired depth perception, which is going to increase their fall risk. So think fall precautions, assistance with ambulation, and maintaining a safe environment. And another important NCLEX point is escalation of care, because sudden Horner syndrome with acute, keyword acute, neurological symptoms is not just something that you monitor. You need to recognize that it could signal a life-threatening condition, and you want to notify the provider or rapid response team if the patient is unstable.